Well, hello, everyone. I'm Randy Van Straten, VP of Business Health with Bellin and Gunderson Health, now known as Amplify. And just a couple things to hit on today. First of all, thanks for joining us. We spend more time at work than we spend outside of work as far as waking hours. So in the employer area, the question today is, what are you doing to help improve the health of your employees and their families? What are you doing? Well, today we're going to talk a bit about our total health package here at Bellin. And this is an employer direct strategy that actually was born here at Bellin back in 2001 when we were addressing a healthcare crisis here with our own employees, when we were looking at cost increases and not knowing the health of our employees. So what happened was we started this program for our own employees. And when the team here, Lynn and I actually reported out to the board, our board members, we're a not-for-profit healthcare system with local board members of business owners. They were interested in the results that they saw and asked us to come out and talk to them as what we were doing. And this actually started our direct to employer business. So it was really grassroots. It was the community asking us to come out and help employers. So today we've got a treat because if you've watched this before, we actually talk with our clients that are out in the field. Well, surprise, Bellin is one of our own clients. Bellin Health is our own client here. And so we've been working on this since 2001. Again, these services that we deploy out to employers, we use ourselves here at Bellin. So we're going to talk about how this program has evolved since 2001. Lynn, it's hard to believe it's been that long, isn't it?
Right.
So we're calling this segment also Caring for Our Team so they can care for the community. Isn't that nice? Caring for our team, because we need healthy individuals. We need people to show up healthy, ready to go in all of our clinics and our hospitals to make sure that we can care for the community. So today, I'm blessed with three individuals here that will be joining us. We have Lynn Nelson. She's our team leader in our human resource management area here at Bellin Health. We have Dr. Brad Wojny, our medical director of population health, and our Bellin Health Regional Primary Care Department Chair. And I need to mention too, Dr. Wojny, you also see patients in the clinic for part of the time too. So you balance a bit. And then we've got Chris Elfner, our Vice President and of our clinically integrated network here at Bellin Health. But he also owns the relationship and helps us with the relationship with Bellin Health as with our health plan and our as an employer. So to get started here, though, I'm going to have you talk about your role with the health plan, okay, a little bit, and then also just a fun question: if you were to take a road trip for 12 hours, and I'm going to date myself here, and you had one cassette tape. Remember those cassette tapes? What band would you have on that cassette tape that you'd pop in? So I'm going to start with Chris Elfner first.
I always made mixed cassette tapes, so that would be an easy choice for me. But if I could only have one band on the mixed cassette tape, it would for sure be the Rolling Stones. Lots of good different music that you could listen to and enjoy.
That's great. Can you just talk informally about your role with the employees of Bellin Health and the health plan?
Sure. My role at Bellin overall is really to make sure that we have payment models that pay us for the value we deliver rather than the services we perform. And then it's to work with the organization to produce that value and make more value. So you'll hear a lot about the design components of what we've done with our own health plan. And those really are driving us upstream to create those opportunities to really help individuals live the healthiest life they can live rather than wait for catastrophic things to happen for them to engage with their healthcare. So get them engaged, be a part of the journey along the way, and make sure that they are living the healthiest at whatever generation they're at.
Great. Awesome. I'm going to toss it over to you, Lynn.
So my cassette tape, and I'll date myself as well. I did what Chris used to do, make a mix from the radio, right? You'd tape it with the cassette tape. But what got me through college was I had a cassette tape of Kenny G. So I would study with that all the time. I haven't listened to Kenny G since college, but that's what popped into my mind when you said that. So I'm used to Spotify and things like that now, not
Right.
cassette tapes. My primary responsibility here at Bellin is to administer the benefits for our employees. So looking specifically with the health plan and the things that we do, make sure that it's affordable and they have great coverage and they're taking care of the needs that they need and not worrying about high cost claims. So that's really my role as we talk today.
You would do a great job, Lynn, in taking all the ideas that Chris and Dr. Wajni and I have and packaging them in with incentives to help people do the right thing. So thank you for what you do.
You bet.
Dr. Wajni?
So we maybe should have rehearsed before we did this because my tape would be the Rolling Stones as well. In fact, Hot Rocks Volume 1 is what I would choose. So, my role here is really three different things. So as a medical director for Pop Health, I'm the medical advisor for this group. So looking over our claims, looking for where we have opportunities and helping guide the team to do that. In my chairmanship for primary care, then I have to spread this to my colleagues for the department that I oversee. Want to make sure, is this accepted to them and are they following the practices that we would expect them to be doing? And then third, as a practicing clinician, I'm in the room with the patient. And does it really work when I'm one-to-one with that patient? And I think that perspective, I think really helps us to perfect our model so that it works like we expected it to work.
Yeah. So it's great having you hands-on, seeing Bellin covered lives, right?
Mhm.
Now
Right.
we branded this program internally here, Bellin First. We call it Bellin First. And I'm just wondering, let's stick with you, Dr. Wajni, on, so it really removes those financial barriers to care.
Right.
So your primary care services are covered at 100%, whether it be preventive or chronic or acute, it's covered at 100%. So you at the front line seeing patients, what does that do?
Yeah. Well, when we remove that financial barrier, it really allows us to guide our patients to take better care of themselves. So they're not worrying about the finances. Part of what we ran into before we started this program is we saw internally that our Bellin employees, they were not reaching the healthcare goals that our other patients were. So, disease management was worse, cancer screenings were worse. And putting this in place changed that significantly. I'll use diabetes as a good example. We follow a composite score for diabetes where there's a group of 5 things that we want every diabetic to get to. Some are lab values, some are medications that they take. And the percent of our employees who have reached all 5 of those composite measures is around 62%, and that's 13% higher than our other patients. So again, remove the financial worry, that financial barrier that they have, so they can concentrate on taking care of their chronic illnesses. We know that's going to improve their health and their mental well-being.
That's great. That's great. Now, I'm going to just cut right to the chase here and toss it to you, Chris, and say, so we've got those quality measures that Dr. Wajni talked about. So great things happening. But how does this impact then primary care utilization? And then what most people are interested in today is the overall costs. What are the costs of this and how does it impact costs?
Yeah, thanks, Randy. So not only did we make primary care 100% coverage, we implemented a wellness certificate that drove people to primary care, ensuring they have a primary care provider and they're getting their preventative age and gender screenings appropriately. it was a conscious decision actually to drive utilization to primary care. And if we're going to overutilize healthcare, primary care is the space where we want it to happen with your partner, the person that's really helping you through your healthcare journey and knows the broad system and can drive you to the right place. Um, they say there are studies out there that show that every dollar spent in primary care produces a $13 reduction in downstream revenue or downstream care needs, which is mostly specialty care or hospital care. And in many cases, it's catastrophic care. So overutilization in primary care isn't really overutilization. And it has flattened our medical spend. So our medical spend had been climbing for many years until we introduced this, what we call the Bellin First program. And now we've managed to flatten out our medical spend. And I know a lot of people say, well, doesn't that make the health system lose money because you don't have that specialty spend? And the truth is, with we have lots of people in our market and lots of people with healthcare needs, and the hospital is plenty busy. What we want to do is we want to reduce those catastrophic cases that are unpredictable and really interfere with an individual's lifestyle.
That's great. We want to prevent bad things from happening to good people, right? And that's what we do with this plan. So that's significant cost savings. I'm going to toss it back to Dr. Wajni and talk a bit about the prevention piece here. Tell us about the health outcomes linked to prevention and getting people in, because what Chris talked about is there's a spiff, right? There's a incentive to get in every year. I know I need it. Sometimes I have to have my wife remind me that I have to go in for those preventive things, or sometimes Lynn calls me to. But why is that important? And what are you seeing with this program, with the incentives and then the removal of barriers?
Yeah, from an incentive standpoint, really, it's driving our cancer screening. So Chris had mentioned the age and gender specific cancer screening. So for women, breast cancer screening, for men and women, colorectal cancer screening, and then for women, again, our cervical cancer screening. And we saw a significant uptick in those right now with our Bellin Health employees. Our mammography screening rate is 98%, almost 100%. Almost every one of our eligible women have had a mammogram in the last 2 years. That's 13% above the rest of our patients. Colorectal cancer screening rates, we see colorectal cancer screening rates that are 5 to 10% above the rest of our patients. One other thing we did from a cost standpoint, this is even before some of these plans came through with the Affordable Care Act, is we tried to remove the barrier for colorectal cancer screening if you had a positive test prior to the screening. So a stool-based test that was positive. We eliminated that diagnostic charge, and that's driven those rates. Blood pressure control is another one. We're well above the national average for blood pressure control with this program. So again, just focusing on those interventions and screenings early on are going to drive your outcomes down the road.
There was a chart I saw a while ago, and as you talked about this, it came to mind. When you look at 5-year survival rates of stage 1 cancer to stage 4 cancer. So
yeah.
It's amazing. If you
Yeah.
can capture those cancers in stage 1,
Yep.
they're close to 95 to 100% curable.
Yes.
Whereas when you wait till like stage 3 or 4,
Yeah.
it's sad. It's really sad. So
Yeah.
and then when you look at the cost also, early detection, lower cost, treatment and so on. So
For
anyway, very, very important. Now, going to toss it, Lynn, we're going to eventually get to you here. Okay. So I'm going to toss one more ball here back to Chris. Chris, something else that I hear when I'm out talking to employers is the rising costs of and the incident of musculoskeletal costs. Okay. Aging workforce, technology, surgeries, people getting total hips and total knees, people being not as physically active, it's all adding up to that. you set something forth a couple of years ago at Bellin, and we've had some success with it. I'm just wondering if you can talk about our 100% covered physical therapy.
Yeah, absolutely, Randy. You know, old cars need service, and the same is true for people. So we got to make sure we get them in for the service and get the parts fixed when they need to get fixed. 100% coverage on physical therapy was not an easy sell to our organization because there wasn't a lot of that going on as we were starting this program. But I talked with one of our employees, and he said to me, Chris, I don't understand. Why was physical therapy so expensive before I had the surgery? But then after I had the surgery, it was free and it was fully covered for my recovery. And and that really made me think about that and wonder why would that be the case? So we did 100% coverage on physical therapy. You walk through the door of a Bellin physical therapy or group, and it's 100% coverage. With that, we were hoping to see a decrease in back surgeries and decrease in joints. We saw a 75% decrease in back surgeries, and we saw a 10% decrease in our joint surgeries. And the dollars that we saved with those more than paid for the coverage of those physical therapies, the 100% coverage. And remove it worked because typically, you have to get a referral to have coverage for physical therapy. So we just made it open access and moving upstream those who might have waited a little bit longer to come in for physical therapy and not been able to get through it without surgery. We're able to manage that issue and recover without surgery.
Yeah, I think that's key is when we worked on the design of this, beforehand, you needed to go see a Dr. Wajni and get a referral for a PT. So that was one more step and another delay. And then, you needed to make an appointment for PT. So the way we made this was you can self-refer right into physical therapy. Just call, book an evaluation, and you're in. And that just made it, that's the other thing is not only making it easy to use with the 100% covered, but also making it just easy to access too. All right. So, Lynn, switching over to HR and, your role there, this proactive care. So this is really proactive. And from your perspective, how have these initiatives impacted the employees and their families, in your words?
It has been all positive, I would say. You mentioned referral, and I had a little flashback to the first year when we had required people going to their primary care to get a referral for PT or specialty or whatever. We did that for 1 year and learned, like we do with Bellin, we're very agile and we can change that. I think driving our employees to primary care was great. It was a great focus and set us up for Bellin first. So when somebody has a concern or an issue other than preventive, because they would go to their primary care, now they're going at no cost. So they can go see Dr. Wozni or any of their primary Bellin primary care and have conversations about A1Cs and not worry about the financial impact of that. I had a coworker that had a child wake up sick and was able to take that child to Bellin urgent care, which we cover at 100%, and so there's no cost to the employee, and was able to go to urgent care, get the needs taken care of for her child, and then make it back to work, and had that relief of being able to get the care right away and get back to work. So it's been a great experience for us.
That's great. How has this been contributing to our retention rate?
Our retention is wonderful. We're at 87%. Our target is 86, so we're exceeding that, and that's good. Since COVID, there's a lot of movement about changing employers and moving, and we're able to keep our employees. And one is because of the health plan that we offer. So we have great numbers.
Yeah, I'd say I've been here since 1981, back when music was really good. So that's why my cassette tape would be Tom Petty and the Heartbreakers. Because I have been stuck in a car for over than 12 hours with one cassette tape. And that's the one it was. So I know every song, and I still love it. I still love it. Anyway, now let's turn back to Chris. So Chris, I know that, there's new options for care popping up in the community, new competitors, in an independent hospital coming up, and some other physician groups. So how do you see, Bellin, for the benefit of Bellin Health and our employees, in your words as a client, right, producing services for an employer, what are the advantages of working with a health system, okay, rather than small independent groups?
Yeah, so Randy, Bellin's an integrated health system. So we have primary care, we have urgent care and fast care, fast lane, but we also have specialists. We have specialists that are part of our system, that are part of the team with the primary care team. We have the hospitals and surgery centers that can really round out the service. So it reduces duplication of imaging or labs. It's all in our system, and we can see that entire patient record. So that team-based approach is really important for managing an individual to the most appropriate care setting at the most appropriate time, and in a way that they need it. So providing that appropriate care and a safety net, it's something a lot of independents, they might not be able to offer that. Bellin being an integrated health system with hospital, I mean, we never close. We're open on weekends, we're open on holidays, we're open at night. If you pick up the phone, you're going to talk to somebody from Bellin. Like they say, we'll leave the light on for you.
I love that slogan. And you think about it, something else that our employers love with our direct to employer services, again, is that we do pick up the phone 24/7 and on holidays. So if you've got one of our on-site or near-site clinic relationships, guess what? That phone number is answered, and you're scheduled for appointments 24. So we'll schedule that for you for the next time that's available. But yeah, we do answer the phone and or triage you based upon your symptoms to the right level of care with our triage system. So Lynn, I'm going to toss it back to you here. You must measure this. How satisfied are the Bellin employees with what you've put together over the years?
Well, we have an employee survey around Bellin First and PT and physical therapy and occupational therapy services. And 86% of our employees feel that the program adds value, and 75% consider it successful, and we have a 95% recommendation to keep it going. So that helps our retention rate, as I've talked about before, and keeps our turnover low, as one great health plan that we have.
That's great. That's excellent. I'm going to go to Dr. Wojny. So you give you the crystal ball question here. Crystal ball. Yeah. So what do you see next for Bellin First? Where's Bellin First going for our employees?
Well, like Chris had mentioned, for our medical care, we're available 24/7. We have virtual care available. We have telephone triage and that. We're looking at that for physical therapy as well. So a virtual physical therapy platform that an employee can interact with 24/7, so they don't have to wait to call. They may be able to get something done on demand for them any time of day.
That's great. So I don't know if I've shared this with you all, but so this is the virtual PT is a pilot with Bellin employees. And I've been having some back issues as I am a runner, and I was training for Grandma's Marathon in Duluth this past weekend. My back was really bothering me, and I couldn't balance my schedule to get in for physical therapy. So I thought, you know what, I'm going to try this virtual physical therapy thing. So I tried it for I'm using it for like 3 weeks. I was skeptical of it. Totally got me some exercises that really helped out. I could do it consistently because my appointment for my first appointment was at 8:30 in the evening, which was really convenient for me. And I just set up my phone. They gave me a little stand to put my phone on, and it really worked. And then the other thing that I thought was interesting was they asked me other things that I was doing within my life. And I said, well, I'm training for this run, but sometimes I feel really bad at that last, 8 miles of a marathon. And they hooked me up with a registered sports nutritionist that helped consulted with me on nutrition pre and then during. Totally changed what I've been doing. And I've been running marathons since the late 80s and totally changed what I was doing. And I took almost 30 minutes off of my last time, improved. So I'm a believer, Brad. I'm a believer. That could be a song. I'm a believer.
That's great to hear, Randy.
Yeah. So I'm going to go back to Chris here. And so let's talk about also, I know you're a big data guy. Let's talk about the data-driven approach to this, because this is something other employers should also understand is find out about the data. How are we doing with the data, right?
Yeah. So thanks for not calling me a data geek like you do sometimes. It's really important that you understand your population and understand what the needs are, and then design interventions for that population and activate the team to care for one another, activate the individuals, and monitor those outcomes. So we do use a very data-driven approach. We have learned that if we really know our populations and we set good targets, we can really help them manage their health and manage it in a very affordable way. And then watch the results as come through. We have great data. And so you say data, I think we need information and knowledge. So we got to turn that data into the knowledge so that we can act on the most important things. And we've got claims data. We've got data out of the EMR. We're even collecting social determinants information. So we know social things that people might be dealing with. We ask them at their annual physical when they come in, and get that information. All of it comes together for a picture of where the opportunities are to really have an impact on, in this case, the Bellin First population. Make sure what we're focusing on and what we're doing with this population is what's most important to them.
So speaking of social determinants of health, right? So those are assessed on an annual physical. I just went through mine. You get a questionnaire. Dr. Wajni, why is that important in the health of a patient?
Well, it's pretty well known that the health status of any particular person, about 80%, sometimes 85%, is not due to healthcare, not what I'm providing for folks. There are other determining factors, and a lot of them are what we call social determinants of health. Things like financial stability, housing stability, transportation, food security. So there are 9 domains that we assess on a regular basis. And I can, give you a perfect example with one of my patients who happens to be a Bellin employee. Unbeknownst to me, he had housing issues. And through that assessment, we learned not only did he have housing issues, he was homeless, still coming to work. None of his coworkers knew that he was homeless, but we have protocols based on how people answer those questions to get them hooked up with appropriate resources. And in this case, I had him evaluated and seen by our case management staff, who was able to eventually secure him stable housing. And he's been doing, as you would expect, now that he's not homeless, his disease management is much better. He's coming to work and he's thriving now.
That's great. That's
Yeah.
a great story. That's why this matters, right?
Mhm.
Now, moving back to Chris, it's clear that Bellin lives its vision to lead with love, as we just heard from that story, and in the case of Bellin First, and walk the talk. So, what's your next big dream for Bellin First, Chris?
So my dream is to double down on caring for our Bellin First population. Just like your retirement fund, you want to compound these gains that you see. So we need to put it back in and invest in other upstream things like covering medication for chronic disease at 100%. So we remove the barriers that individuals have in doing the right thing. We want to make it very easy for individuals to do the right thing, to be healthy and to take care of themselves so that they can be healthy and longevity and have a long health span. Um, Other upstream things, thinking about healthy food. How can we make sure that people are getting healthy food and maybe even covering it, or the weight loss programs and our lifestyle medicine program, which we have and we do include in this program, but expanding that and making sure that the components of those upstream programs are covered at 100%.
Yeah, I'll add on to that, Chris. I think that's really, really important to try to prevent those things down the road. An offshoot that I've learned is when we do this, it makes my job easier. And making my job easier, I can interact with patients better. I know they're doing better. They're going to be happy. They're going to be healthy.
It's great.
Yeah.
Lynn, going to toss a slightly different question to you here. What do you think makes Bellin Health special in your view?
I've been with Bellin for not as long as you, Randy, but 24 years, coming up on my 25th year, and we take care of our people. We have a paternal approach for our employees as well as their families. And if you think of everything that we've just been talking about, the comprehensive care approach that we support and believe in. Really, if you look at our high, preventive screening ratings and all in the preventive care that we get from primary care, that's going to keep us around for another 100 years. So that's very important, and what's so special about Bellin.
Hopefully I'm retired by then. All right, we're going to round this out and close it down with last words. So any last words, Lynn?
From a retention and hiring perspective, I believe Bellin First helps us recruit and retain our employees and help remove the barriers to care.
Yeah. Toss it over to Dr. Wajni.
I think it's our focus on the outcomes, both disease management and preventative outcomes, making sure we're providing the best care so that our patients, employees, and their families maintain great satisfaction.
That's great. Over to you, Chris.
I think those are two great things we did, and I think it's even better that we did it while leveling off our medical spend through this comprehensive and preventative care. So not only are we able to do great things for our population, but we've made it financially sustainable.
Yeah, that's great. So what's interesting is y'all just summed up the triple aim. So really, if you think about it, Lynn, you talked about that experience for our employees. Dr. Wajni, you talked about the quality and the outcomes, and Chris, affordability and the cost. Those are the three things. You need to pull all those levers to make a successful plan for your employees. And that's something we've been working on here since 2001, and yet also helping other employers in the market do this same thing. So I want to thank you for your insights and your time today. And we love helping employers in our community here. We love doing this. We love helping you figure this out. And if you're interested in this approach, definitely visit us at bellin.org/for-business. Or you can just email me directly, and we'll get my email up here. Email me directly also, and we'd be happy to have a strategy session with you to listen first, to see how we might be able to co-design a solution and then as you can see, deliver with accountability. So thank you for your time today.
Welcome.
Thank
Thank
you.
you, Randy.
Thank you.